There are many different disorders and diseases that are underneath the umbrella of mental health diseases. One of the specific disorders under that umbrella is obsessive-compulsive disorder, or OCD. Obsessive-compulsive disorder is a mental disorder involving an uncontrollable need to perform certain motor skill tasks, repetitive behaviors, or rituals. Commonly, a person with OCD may or may not realize that their obsessions aren't reasonable. Oftentimes, that person will try to stop or ignore their obsession. Trying to stop or ignore the obsession only increases the person's distress and anxiety levels. The effect of trying to stop compulsive behaviors oftentimes only makes the person do the behavior more because it helps to relieve their stress. A person with OCD symptoms usually has both obsessive and compulsion symptoms, but it's also possible to have one but not the other. OCD obsessions are repeated, persistent, and unwanted urges or images that cause distress or anxiety. An example of obsession signs and symptoms is intense stress when objects aren't orderly or facing a certain way. OCD compulsions are repetitive behaviors that you feel driven to perform. These repetitive behaviors happen to help or prevent or release stress. An example of compulsion signs and symptoms is checking doors repeatedly to make sure they're locked. A person who believes they may have OCD can start by seeing their primary doctor. They should know that due to the fact that OCD often requires specialized care, they may be referred to a mental health provider. This means they could be referred to a psychiatrist or a psychologist for evaluation and treatment. OCD treatment is helpful with getting a person's symptoms under control so that they can live their life without their symptoms ruling their days. There are two main treatments for OCD. They are medications and behavior therapy. It has been discovered that certain psychiatric medications can help control the obsessions and compulsions of OCD. The most common medication tried first is antidepressants. So according to the Mayo Clinic staff, there are 5 different antidepressants that have been approved by the FDA to treat OCD. So oftentimes a person may have to try several different medications before they find the one that works the best to help control their symptoms. So it is important that before a person decides to make any changes to their medications, that they consult their doctor so that they are making the correct decisions. Another way to treat OCD is through behavior therapy. Exposure and response prevention, or ERP, is a type of behavior therapy that is the most common and effective treatment for OCD. According to the Mayo Staff Clinic, this therapy involves gradually exposing you to a feared object or obsession, such as dirt, and having you learn healthy ways to cope with your anxiety. So exposure therapy may not come easy, and it will take effort and practice, but eventually the person can enjoy a better quality of life using what they've learned from ERP to manage their obsessions and compulsions and to cope with having OCD. So obsession-compulsive disorder is a chronic condition. This means that it may always be a part of a person's life. Due to the complexity of OCD, each patient and case is different. Depending on the severity of a case depends on how often a person needs to be treated. Some people may need to be treated for the rest of their lives. Other people may just need to see their mental health provider until they are able to be in control of their OCD. Also, it is helpful to be able to cope with OCD and have strategies so that it does not rule a person's life. So, the patient went to her primary doctor after realizing that she has some of the signs and symptoms of obsessive-compulsive disorder. She learned that OCD is a mental health disorder involving an uncontrollable need to perform certain motor skill tasks, repetitive behaviors, or rituals. She was referred to a psychologist for further treatment. After being evaluated, the psychologist diagnosed the patient with OCD. The patient has both obsession and compulsion symptoms. This means the patient experiences obsessions that are repeated, persistent, and unwanted urges or images that cause her distress or anxiety. And she experiences compulsions that are repetitive behaviors that she feels driven to perform. The patient told her psychologist that she does not want to be on medications for her OCD. She understands that in the future her OCD may get worse, and this may cause her to have to take medications to help control it. But for now, her psychologist is treating her with behavior therapy. The specific behavior therapy he is using is exposure and response prevention, or ERP. ERP is the type of behavior therapy that is the most effective treatment for OCD. Starting out with ERP therapy, the patient has to see her psychologist at least once a week or more if needed. As the patient continues to cope with her OCD, she may need to see her psychologist less and less. That is okay. Every once in a while, she may experience an extremely stressful day or extremely stressful situation and may need to make an appointment with her psychologist. That is okay too. It is important for the patient to understand that OCD is a chronic disorder and she will always have to deal with it in some shape or form. Also, she needs to understand that there are ways that she can cope with her OCD and control it so it won't control her life.